Hey guys, it's Wednesday and just finished consults. It's 8 p.m. so it was a lovely Wednesday. I missed the gym, but everyone was delightful today. Again, I had a common theme today, and the lesson of the day, or what I learned amongst the several patients, or what I try to talk about, was actually two things, and both of them had to do with the middle layer of the face. One of them was about mesotherapy, and the other one was about fillers and how they age and how they change over time. So I'll go over mesotherapy first and what we talked about. Mesotherapy refers to any kind of treatment that you do in the mesoderm, or the mesial layer of the face, which is the middle layer. Outside, inside, middle layer. Middle layer is kind of where your fat and everything else lies. And mesotherapy could be injections to try to shrink that area, or injections to put vitamins into that area, or injections to grow that area. These are all mesotherapy. The majority of the time when someone says mesotherapy, though, they're referring to agents that go and kind of melt fat or try to scar down tissue or shrink it in order to get a tightening or a shrinking effect on the face, instead of doing liposuction or a heat-based therapy or something like that. Those kind of mesotherapies fell out of favor largely in the world because they were causing indents in different parts of the faces and irregularities, as well as atrophy and deflation of the face. And this happened because we were getting rid of the fat, melting the underlayers, and people were losing volume. So if somebody has had mesotherapy and they've lost the volume from the face, the question becomes, can you replace it? The answer is easily no, you cannot. What is gone from mesotherapy or over-aggressive Ulthera or things like that, you can't replace. But you can try to make the volume a little more supple and a little more soft again by doing nanofat, PRP, and that kind of stuff. And ultimately, a lot of the patients who had mesotherapy need facelifting. And the reason for that is, one, they needed facelifting to begin with and didn't really need mesotherapy. The other is because mesotherapy can deflate the face and make everything collapse a little bit, and then they need it. The more strong you get, the worse off it is. The more diluted it is, the better off you are. So for these patients, and I had two of them today, we talked about the same thing, which is lifting and then maybe doing tiny bits of fat, nanofat, PRP type treatments under the skin. So the other thing is about filler and filler aging, how do fillers age? So question came up today, what do you think about these different fillers, or what's going on under my eye? And we've talked about this, or I've mentioned this before. Fillers, even the hyaluronic acid fillers, can last 10 years. They can last more than that. The thing that people haven't really understood fully yet is what happens to those fillers over time. So you put a hyaluronic acid filler in, and you put in something that's 20 mgs per cc of hyaluronic acid, or with whatever specific type of cross-linking, and let's call it Voluma. And you put Voluma in the face, and Voluma is supposed to last 2 years, they say, but we know it can last like 10. The thing is, with Voluma or Restylane, you put Restylane under the eye, it might be Restylane the day you injected it, which has the exact properties of Restylane that you purchased from the factory, which is a nice gel that's a beaded gel, and it's non-reactive or minimally reactive under the eye. But 5 years later, what's there is not the same gel. It's a different gel. It turns into something different. It changes its cross-linking a little bit. It starts to migrate. It comes to the surface. It goes from not clogging lymphatics to clogging lymphatics, and it changes its character to something that's not typical of Restylane. So that can happen. You can also cause scar formation around hyaluronic acid fillers. It's much less common and much less reactive, so you don't really see much scar tissue formation around hyaluronic acid fillers, but you do see changes in the character. The other thing is mixing. You can get mixing of fillers, and it also changes the character. So you inject Restylane here, you inject Juvederm there, they can connect, and now you have a new filler. So those kind of things can happen too. The only important thing to know about that is, don't assume just because you filled something 5 years ago that it's the same non-reactive perfect filler for that area. It might change its character and cause problems. Another clarification point, somebody asked me, an injector who's very good said, I thought you don't like fillers. And I said, what would make you think I don't like fillers? And it was because I speak negatively about fillers on social media. And I explained that I only try to help people do fillers better. I believe in fillers. I believe in Botox. I just am very realistic about the problems they can cause. And just like surgery can cause a lot of problems. I'm not saying don't do surgery. I'm just saying do it right. And with fillers, I was one of the busiest injectors in Beverly Hills. As a single injector, I was injecting more, mostly Galderma stuff, but I was injecting more than 5 doctor practices. And if you ask all the reps in the area, they'll tell you the same thing. I was injecting volumetrically more than everybody else because I was working 6 days a week and I was injecting 20 to 40 patients a day, every day. So I used to do a lot of injections. I don't do it now because I'm operating every day. Now let's get to the other fillers, what happens. So you have Radiesse, for example, and this is something someone was just asking me about. Radiesse is calcium hydroxyapatite, and that's a bony paste filler. So it's got bony minerals in it, and when you inject that into the bone, sits there and might calcify, might not. Nothing happens bad. When you inject into the soft tissues, the literature is very foggy on what happens to Radiesse, and when people and doctors teach about it, they say that it forms forms collagen, and people think that's a healthy thing. Realistically, when you inject Radiesse, about 6 months later, you're actually forming calcium crystals. And the crystals calcify and scar the area around it into a rock. So it gets very, very dense, the parts that don't get reabsorbed. The parts that get reabsorbed go away, they don't cause any problem. But the Radiesse, when you inject it into the soft tissues over here, even though volumetrically it's causing a nice change, turns that area into rock. So when people feel it, it feels a little bit firm. And then if you go operate on it, you can't cut through it with a scalpel. It's something that you have to keep using scalpel after scalpel to get through. So it causes these rocky calcium formations. They're bony mineral deposits surrounded by scarring, and they're very difficult to get through. And if you were to ever inject Radiesse in the under eye, you are screwed for life in most cases. Most patients can assume they're going to have some kind of negative effect lifelong. The lucky ones, this bony minerals under the eye go away. So Radiesse should never be injected into the under eye. Aside from the risk of blinding somebody, the risk, I'd say, is unknown if there's a difference between hyaluronic acid filler and Radiesse. That's not really the risk I talk about. The risk that I'm talking about is more the long-term edema that you get from Radiesse. So if you ever put Radiesse in this area, or you put it here and it slips over there, you can cause permanent malar bag formation and darkening of the under eye, not from hollowing, but from water formation. And the rep used to tell us from the company, oh, we have this doctor who goes and injects right down here on the foramen 1.5 cc's, and it just plumps everything up, and it's amazing. And I believed that when I was like coming out of residency. I never tried it, but I believed it because I was uneducated. I didn't know any better. Now I know that things don't work that way, and there's no magic, and it doesn't lift that way. And I'll never place Radiesse in the under eye. The places that I'm okay with it is the cheek laterally. If you want to go on the mandible, you can. If you want to go on the chin, you can. Just make sure you do it right, because if it squirts into the neck, you're going to start forming little calcifications and fullness there that wasn't there before. So what are the positive sides of Radiesse? Not much over Voluma. I like Voluma better than Radiesse, and I think it lasts just as long, if not longer. So I haven't seen any long-term benefit of Radiesse over the other one. So that's that one. What happens to Sculptra over time? Sculptra is not a filler. Sculptra is a volumizer, and the differences between dermal filler and volumizer. Dermal fillers are gels that you put into the soft tissues or just into the dermis or under the dermis, and they integrate into the area around them and add volume immediately, maybe drawing in a little bit of water. Sculptra is a poly-L-lactic acid powder that is similar to Vicryl suture, and it's broken down and you put it in the face, and it acts as an irritant, and it sits in the face and it irritates the area around it, and that causes the face to start depositing scar tissue in the form of granulomas. So you get these little tiny granulomas, which are little balls of gray tissue. They look gray versus your fat looks yellow, and they actually look similar in size. So the idea is that you're replacing fat in the face that can't be replaced by other fat. So Sculptra does that, and it typically will form collagen over the next 6 months or so. So it can, not collagen, sorry, scar tissue formation. It's a mistake when people say collagen. There's collagen inside of it, but people don't understand what collagen is. Collagen is a fibril. And what you're seeing with the volume is not a bunch of fibrils added up. It's a bunch of scar tissue. That's what actually adds the volume. And that doesn't mean Sculptra is bad. Sculptra is good and it's useful and you can use it for a lot of different things. But you have to realize that the mechanism by which it's acting is by forming granulomas, little tiny rigid balls, not super soft fat balls or anything like that. So Sculptra is best for diffuse areas of gaunt, like a gaunt face where you have hollowing in the face and the buccal region, and you can't really refill the buccal fat pad. It's not possible. So instead, you put Sculptra and it diffusely adds some bulk. You want to do it a little bit deeper so that hard tissue you don't want to feel. You want to hide it. Now, what happens to Bellafill, Artefill, Articol, silicone, and those kind of things after several years? So most people who buy the product and use the product say that it lasts about 5 years. And that's what the companies say. Realistically, they are permanent or almost permanent and may never go away, and they sit there irritating your face lifelong. So imagine you had Sculptra in there, but it doesn't stop irritating. The volume can keep growing because your face keeps reacting to it. So Bellafill and those things, if you use tiny, minute amounts and you're a very skilled practitioner, no problem. The problem is people think that Bellafill is as safe as the other fillers. It's definitely not, because it can't be dissolved. And it causes more irritation than the other fillers, meaning if you go inject this much volume, you might not end up with that much volume, you might end up with this much volume. Can't control that. And what happens is you get balls in the face, lumps, swollen tissue, things like that. And the rate of that happening is not zero. It's not 100%, but it's not zero, and it's over zero. And that means you're going to have some patients who have permanent problems from it that you can't fix, which means you shouldn't be doing it, because there are other alternatives that are better that can be fixed if something goes wrong. So silicone is not FDA approved for anything in the face. The indications previously were for nasolabial fold and for acne. Bellafill and Artefill similarly, I think, have lost their indications in the face. I'm not sure if they're still used for those things. If you go to the most skilled practitioner in the world, again, if they use tiniest bits, it's fine. But these things over time, they just sit in your tissue and they keep forming scar tissue around them, and different kinds of scar tissue. So silicone forms its own yellowish bed of scar tissue versus Bellafill and Artefill are more rocky-like. They're different types of irritation that they cause, but it's all scar tissue formation, which is not controllable and causes a lot of problems. So fillers change their character over time, not just because the filler can change, but because of the way it makes your body react to it over time and how much swelling it can cause and tissue formation it can cause over it. So that's that. So everybody understands about mesotherapy and fillers, hopefully, that they can change over time. And again, just to be clear, I teach about fillers. I'm not against fillers. I was the highest volume injector in Beverly Hills for several years, 20 to 40 people a day. And if you ever came into my office, you would know that, because I was injecting from 6 a.m. on a Saturday or 5:30 in the morning until like 10 at night. And I'm not slow. When people came in, they were in and out very fast. So I was doing a lot of patients, and I do like fillers and Botox, but I am much more delicate now and tasteful now than I used to be. I just don't do it anymore. So here's some questions. Is it true you can't have Botox after revision rhinoplasty? I went to Turkey and got a revision in August. No, once the swelling is gone in your face and you don't have any visible swelling, you can do Botox again. If you have swelling in the face and you do Botox in that area, it can migrate and people get ptosis and drooping of the eyelids and all that kind of stuff. Can you get nasolabial fold filler and a nose job after? Yes, you can get nasolabial fold filler and do a nose job after. There's no relation between the two. What can be done to improve mid-face dominance? So that's complicated. There are people who have flat under eye, hollow under eye, loss of tissue, loss of bone, and you have to really look at the under eye and the cheek as kind of a pyramid, an inverted pyramid, and decide what you need to enhance, whether it is the bony prominence or whether it's the soft tissue deficit that you have. What else do we got here? Saludos desde Chihuahua. Saludos. Is Botox good for under eyes? So generally, no. Botox is not good for under eyes. There are people you can do microtox on, which means the most microscopic amount for a really hard contracture there. There's some people who do it on the Asian eyelid for a little bit of a pleat that forms under the eye. Other than that, the lower eyelid muscles form a sling across the cartilage of the lower eyelid, and you need those muscles working properly to keep the eyelid tucked up against the eye or else it falls away from the eye. If you ever do here on somebody who smiles like me and bunches and you hit that skin when you smile is not going to contract like an accordion. It's going to turn up like a ball and it looks like saggy skin. So you have to be very cautious under the eye. When will you give away a surgery? I'm not sure. How about Belotero? Belotero is a great filler for the under eye. Other than Restylane, I prefer Restylane, but Belotero is a good one too. But Belotero also can change over time. It tends to go away a little bit faster than Restylane though, so I think it probably causes less of the long-term effects, but who knows? Why are fillers risky? Many, many reasons. All right. You're amazing. Do you do upper lower bleph repairs? Yes, I do. Must inject Restylane filler with a cannula. Don't need to inject with a cannula, but cannula placement in the under eye is more precise because you could place it into what we call the SOOF, or the suborbicularis oculi fat pad, and you can place it more precisely within that while using your other finger for palpation if you're using a cannula. Medially, you don't want to stay on the periosteum. You want to go superficial, actually, which is counterintuitive, but you want to go more superficial because if you inject it into the periosteum here, you're going to inject it. First of all, it's riskier, but you're also going to inject it into the muscle bed, which is where the orbicularis ligament or sling is, where the levators are to the rest of your mouth also. So you end up getting a ridge when you smile over there. Laterally, cannula helps you go a micrometer above the periosteum, because if you stay on periosteum, you can inject into the orbital septal attachment there and make your eye bag bigger on that side. So definitely no radius for eyes or voluma. Correct. Any reason a person would pass out during Botox, as we find in the past? Yes. So anytime you needle stimulate the midface, here, around the under eyes or anything like that, you can get something called a vasovagal reflex, which is a reflex where your vagus nerve causes your blood pressure to drop. So you stimulate it and your blood pressure drops and you get a little lightheaded first, you get a little queasy, your face will turn a little palish yellow, and your doctor usually notices it and lays you down. It takes about 2 minutes for the immediate effect to wear off, 5 minutes for you to really stabilize your blood pressure and everything. So if that ever happens, you just lay back, and before you start sweating, because everyone starts sweating, you get a couple ice packs and you put them in 3 spots. One is on here, one is here, one is behind there. And if you do that and lay someone flat, they'll be fine within 2 minutes. 5 minutes, they can get back up. Do not rush to give them water. Everyone's like, oh my God, get them water. I've never seen water save someone's life, like when they were about to pass out. So all it would do is make them probably want to puke more, and maybe they like choke on it if they pass out at the same time. So if somebody says, go get water, just say, no, don't go get water. Just shut up and stay there. Let me handle this. How about Xeomin? Xeomin is a nice product. It requires, I'd say you have to mix it and let it sit there a couple minutes longer than the other ones, but otherwise works just as well as Botox. Girls who want butt enhancement, not a butt specialist, so I'm not sure. All I know is I've never been amazed by butt enhancement injections. Fat grafting does work, again, but everything has problems or can have problems. All right, lots of questions, and I think we got all of them. Can you explain the benefits of PRP injections in the face and how long it takes to see a difference? So the PRP and platelet-rich plasma can be used in the face along with microneedling, and that helps repair damaged skin, but it also just stimulates the face, so you look better for about 3 months. So I tell people, if you want to keep the face hydrated and looking nice and bright, you can do microneedling for about every three months, maybe 4 months, and it stimulates the face for that time, so your skin looks better. If you just do it once, you're not going to get like any long-term collagen formation. It's not about collagen formation. People say it is, but it doesn't do much. So you will get an improvement in stimulation of the face, so your face will look plumper and more hydrated over that time that it works. And fantastic. Okay, that's all the questions. Mesotherapy and aging of the fillers. So not just aging of your face, aging of the fillers. And the other thing, realize when you keep filling every 6 months, you're adding and adding and adding. That's why everyone's face tends to get bigger over the years. They clog the lymphatics, they puff it up over time. So you don't just fill every 6 months, you fill as needed, only when needed. And again, I used to inject like 5 to 7 syringes on someone's face when I wasn't as smart. Now I can do like anywhere from like 1 to 3 maximum. I'll show you like pictures where I've done 1 and you wouldn't believe it's 1 cc over the whole face, and really that's all people need, and they age well with it, doesn't cause problems. And that's my favorite thing, is not having to fix someone. Dissolving somebody is not easy. It's not fun. For the lip, it's easy. The mid face, not easy, not fun. And that's all. Good night, guys.